Hello, and welcome to another episode of No Notes, where the conversation is always a perfect 10 out of 10. This podcast is powered by Eleos Health, the most used and most loved AI platform in behavioral health, equipping more than 100 organizations and over 10,000 providers with powerful automation tools that streamline documentation, simplify compliance, and surface deep care insights that drive better client outcomes. I'm your host, Dr. Denny Morrison, and for today's episode, we are thrilled to be joined by Raz Karmi, who is Eleos CISO, and Rony Gadiwalla, who is the CIO of Grand Mental Health, to talk about two very big elephants in the healthcare AI room, privacy and security. We'll chat about the biggest data privacy and security concerns behavioral health leaders should pay attention to when implementing a new AI solution and what their AI vendor should be doing to address them. Welcome, Rony and Raz. And thank you for being here. Rony, why don't you tell us a little bit about what you do?
Good morning, folks. First, Denny, thanks for having me. Eleos, thanks for having me here. I'm the CIO at Grand Mental Health. We are a behavioral health organization in Northeast Oklahoma. We cover about 13 counties in Northeast Oklahoma. And we have over 30 locations across those counties. I have about 20 years of experience in the IT field. I've been in healthcare and in manufacturing. I hold a black belt in Lean Six Sigma. I have a master's in cybersecurity. So anytime we're talking cyber and privacy and security, I'm super excited. So glad to be here.
Thanks, Rony. Hey, Raz.
Okay, so hi everyone, and thanks for having me. I'm Raz. I'm functioning as the CISO at Eleos for the last year. I have over 20 years of experience in the information security and cybersecurity field. Being a CISO at Eleos means I'm basically in charge of all aspects of information security, from the corporate side of things to the cloud, application security, governance and regulations, you name it.
And so CISO stands for what?
Chief Information Security Officer.
Okay, great. I've learned something today already. Well, man, you guys are incredibly talented and perfect for this discussion. So, I think, I don't know of any other aspect of healthcare that worries more about privacy and security than behavioral healthcare, frankly. Is AI bigger and more difficult and more important to manage than, say other technologies? And we start with Rony.
Yeah, so I would say, I think with AI, because of the vast amount of sensitive data that it actually processes, there's definitely a bigger emphasis on the security of that data, especially if you're talking behavioral health. The data is extremely sensitive. No one wants that to be leaked out. But with AI, you also have to deal with, how is it collecting this data? How long is it being retained? Is this being used in any other way? Or is it even shared with third parties, right? So that lack of transparency sometimes can lead to some mistrust, right? So, and the risk you run into with this is, if you build this, you break this trust, you're talking clinicians and clients have to share that trust in order to be successful during the treatment journey, right? And so when that trust is broken, even by a data breach, the clinician and the client trust is now in jeopardy. And I think that that's really key to using AI in behavioral health. You want that comfort level, you want that transparency, right? And you want to make sure that the data is used for what the client has consented for it to be used.
Raz, what do you think?
Yeah, I totally agree. I think that first and foremost, with regards to AI risks, is the fact that AI is relatively new to all of us, and it's developing at a very fast pace. And we're still not aware of all the risks. So we're all the time learning as we go. Many AI systems also operate as black boxes, so we're not always aware of how they really come to their final decision making. That goes back to the transparency that Rony mentioned as well.
I think when I think about this, I think there's there's kind of like this kind of standard levels of security and privacy issues that we've had to deal with EHRs, for example, for a long time. And now we've got all of that plus something a little bit new for the reasons you mentioned. This is a new technology. I love what you said, Rony, about when you compromise that technological problem, when that gets compromised, you're also you're compromising the trust that a client has in their clinician, because this is in an odd sense, a clinician extender in a way, particularly with ambient listening. And so those to me do kind of provide a different level of risk. What are the biggest concerns you guys face? I mean, you guys are in similar roles, but one for provider, one for vendor. What are the things that kind of keep you up at night about this stuff?
If I may jump in, I think at least from our perspective, I mean, the baseline is unauthorized access of data, right? You do not want to breach of very sensitive data. That I think is number one. If we can't even start talking about other things if we don't address this first. But you get past that, because there are mechanisms in place that you could put in, to make sure that the content is encrypted at rest, it's encrypted in transit. There are good access control mechanisms in place to make sure that only the right people have access to it. You get back past that, and one of the things that we have been working on or trying to understand is the consent mechanism, right? Is how do we not only just simply get consent to use a product or a platform, but understand what that consent means, as you start using the product, because AI, at least from my perspective, is always learning. So whatever you tell it, you cannot untell it. Whatever it learns, it's most likely not going to unlearn by itself. So imagine a scenario where we have agreed to do one thing together, and during that one thing, it has learned something about me. And then, we are now, you may then ask it about something about myself, and now it's going to use that information that it learned during a consented session to maybe augment or deliver information on something that is not consented. So I think that mechanism is something we're really exploring. Right now, that's really not a practical issue for us. But as we start diving into more and more AI use cases, we really need to be aware of how was this information learned, and can you only use it for consented, sessions? So I think that to me is something that we're really interested in engaging on.
Raz, what keeps you up at night about this stuff?
Yeah, so I agree with Ronnie's number one, which is the data privacy and security. That's definitely number one. We basically, Eleos, we take the holistic approach. So when we build our company AI security, or the more general security policy of the company, we don't look at one framework or one best practice. We look at various frameworks and best practices, and from these we build our the policies and the controls and stuff like that. So we actually cherry pick the controls that are the most relevant to us, and by that we build our information security program. With regards to consent, I also agree, and we have a team of data scientists and data engineers who work day and night in order to make sure that everything's in place, and stuff like that.
Yep. That you mentioned, Ronnie, though, this issue of client consent, and that's always a big one for the behavioral health industry. Raz, when we talk about like client consent from our perspective, what do we expect clinicians, or what do we expect customers to do in terms of getting consent for using Eleos products? Do we have a position on those kind of things?
So first of all, we're HIPAA compliant, and according to HIPAA, there should be a consent process where the customers need to fully understand the purpose of why we're, for instance, recording this call, how this data is stored, what is it being used for or shared. If we have any retention policy, if we delete it after a certain amount of time. And I think that's at a high level.
And for your place, Ronnie, how did you guys deal with this consent issue?
But for us, we worked with Eleos to actually develop the consent form that we would present to our clients. So our clients would have the opportunity to read through it, understand, ask questions. The consent is documented. They have the right to revoke that consent. So even with telehealth sessions where you have clinicians, joining a call, client joining a call, and the Eleos bot joins the call, the client has the right to say, today, I don't really want the bot, and the bot is kicked out. Okay.
Hey, so what do you guys see? I mean, you were talking about kind of like the regulation stuff, but what do you see as some of the common myths and misconceptions about privacy and AI? What do you hear that people think you have to do and don't, or the other way around? Raz, what are you familiar with that people just get wrong about this?
So the misconceptions that I hear a lot are mainly around that the AI collects only the relevant data, only the necessary data, which is not true in many cases. That AI, you can trust AI with your eyes closed. You don't need any human oversight, which also is not true. And I think another one is that AI systems can't be fooled, which also is not true. There were quite a few, stories and blog posts recently that shows otherwise.
So what about you, Ronnie? What do you see? I'm especially interested from your clinician's perspective. What are the myths that they're bringing to you?
From a security and privacy standpoint, the one that the thing that intrigues me the most is it really falls on where you fall on the debate of AI, right? So if you are pro AI, okay, you're going to feel that AI is inherently secure, and because it's advanced technology and it's so much better than the old stuff, right? And if you fall on the other side of the debate, you're going to say, hey, AI is constantly leaking PHI. Okay. You ask it a question about yourself 6 months from now, it's going to leak out all the things you told it. Okay. And the answer, in my opinion, is depends on the technology of the platform you're using. If that technology was built with privacy in mind, designed for security, okay, has followed regulations, is complying with audits, then you are safe. You are, it's like buying a car that is safe, but then driving recklessly and saying, "But I'm in a safe car," right? So you have to, again, have you have to look at the two sides of that same coin. And if the platform is not built with security in mind, then yes, the latter part of that myth is true, that it could leak PHI. So
well, and that's a really good segue into kind of like the question about from the vendor and from the end user's perspective, what are the things that are essentially non-negotiable when it comes to privacy and security? Things, that we just literally cannot compromise on. And from a vendor's perspective, Raz, why don't you kind of take it? What are the things we just have to do? We cannot not do.
Yeah. So specifically in our field, the healthcare field, we need to be HIPAA compliant. That's something that we can't compromise on. Then having the appropriate security measures. We spoke earlier about the data security. So having all the relevant security controls in place to make sure that everyone is safe. The smallest breach could kill a business today. And of course, adhering to everything that we have in our agreement. We can't write something in our agreement and not have it, implemented. I think these are the main, and also going back to transparency. That's a must to have a vendor and a client relationship.
Rony, from your side, what's non-negotiable?
I think to Raz's point, there are some the bare minimums, right? I mean, you have to be HIPAA compliant. You have to have encryption in place. The things that we've come to expect, not just from AI products, but pretty much anything that's out there right now, which makes it really only because regulation's still new or in the process on hopes. So you're relying on HIPAA's been around. You at least do that, right? But to me, I would also want to look at, data minimization, for example. Like, are you only collecting what you need to do your job, right? And I think that would be an expectation from almost any other product. So I would overlay that expectation even on AI. Don't collect something you're never going to use, right? So it's again, retention. You may need it to complete your job, but then do you really need to keep it, right? So that's where that comes in. Are you anonymizing the data? I think that's really important too, because if the data is anonymized to a point where you cannot connect it back to the client, even if there were a breach, it's still bad from a public opinion standpoint, but at least it's not tying it back to a client. So in my mind, the client's privacy has not been compromised. So I think that's, goes back to my expectations other than, the transparency, the usage of data. If third parties are involved, how are they getting access to this data? Those are the non-negotiable items for me, because that's core to any technology we place in our business.
So when you guys kind of look in the future, what do you see in terms of the regulatory environment coming down? Do you think things are going to change? Is it going to be pretty much the same, just more formally enforced? What do you think, Raz?
I'm not sure about what's going to be in the future, but I'm sure it's going to be tougher and stronger than today. That's for sure. I can see every, on a weekly basis, there's a new framework or a new regulation, whether it be in a specific state or in Europe. So it's definitely going to be much more tougher. And we from our end, we need to be, you need to stay informed all the time. And read the newsletters, the blog posts, and just staying informed all the time.
Rony, how about you guys?
Yeah, I would agree with Raz that staying informed is really important. Keeping up with the new changes that are happening, but also being able to proactively adapt to those changes is really important. So you really need a partner that's willing to work with you on the changes, because jurisdictions might be different. So if you're in California, you're worried about different things than if you're in Oklahoma. And so a partner that understands that, values that, will go a long way. you also need to have a good compliance team, right? And your compliance team might be used to different things than AI, right? So training your compliance team to bring them up to speed on what's going to be required to be compliant with new AI regulations. I think that that's really, really key as well. So that it changes, it changes that dynamic. But again, when I think about responsibility for security, I think of it as a collaborative approach between the vendor and us, right? Because to my car example that I gave, I could buy a perfectly safe car, but if I drive it recklessly, then I have compromised the safety of the people in that car. So it didn't really matter. The vendor did everything right, right? And it works the other way around too. So I think that part's really important. Now, what's coming out of some of what we're hearing in the media and what we're reading, I'm excited about what the Biden administration did with the executive order, because I think that if you read between the lines, you're seeing that there are agencies. So legislation, let's say, takes a little bit longer. It always does. Lawmakers have to learn what AI is, and then, so they're going to have a lot of committees and things like that. So the executive order kind of puts things in motion as a stopgap measure, at least from my perspective. And one of the things that I really like about is that, there are agencies, federal agencies that can help. So NIST being asked to come up with a standard, I think that's a great start. I mean, that's how we ended up with, the 583, or 500, sorry. And so, that's for cybersecurity for federal employees. And so, seeing agencies like, the FTC being asked to weigh in. So, that the same protections that you have from the FTC for regular products are now going to be extended to the ones, hopefully, now going to be extended to the ones that are AI based, right? So there's no gray area on, well, this is not a regular product. This is an AI product, so it lives in this gray zone, right? And then asking the Health and Human Services to oversee the safety of AI products. I think that's a great start. That's how HIPAA came around. And I think that this would be a great way for the same organization that oversees some of the enforcement of HIPAA to also be involved in the safety of AI tools. And I think that those are giving me some confidence that we're moving in the right direction. Will legislation catch up? Hopefully. And there are other organizations that are coming up with guidelines, coming up with, best practices. And I think that those would be instrumental in developing what I think will end up being legislation.
Very cool. Guys, this is very helpful. I think we could probably talk for another hour or so, but we need to wrap it up. I want to ask you to kind of, for people who are either early in their kind of search for AI or maybe in early adoption phases, what's the one piece of advice that you would give them relative to privacy and security? And Raz, we'll start with you.
I think the most basic thing I can tell is just don't be afraid of it, and don't listen to all the myths that we mentioned earlier in our discussion. And yeah, I think that's it. But of course, make sure that if you choose to work with a certain AI system within your organization or wherever it be, do a thorough studying about how they work, how they're implemented, what are the security controls they have in place, etc., etc.
Yeah, Raz, I absolutely think that people should not believe in myths, but I think they should validate them through some research as well. I think the important thing for agencies like us to do is do our due diligence, due care. That's our responsibility. So we are looking at partners. When we're looking at partners, we want to make sure the non-negotiables are easily checked off. We're like, are they HIPAA compliant? Do they have their SOC 2 Type 2 certification? Do they have high trust? So that way you're making a more informed decision. I think that going back to the transparency when you're deploying it in your environment is super important. But do your research. Not all platforms are built equal. Not all platforms guarantee you that you will not commingle your data with somebody else. Okay. So that's really important. But maybe start with from within your own organization. Have a well-written, well-thought-out, well-supported AI policy for your organization. Okay. Yes, it won't be perfect. Just like every policy, you're going to tweak it over time. You should be reviewing it. I would recommend having an AI committee that helps you build that within your organization. And again, you start small. You could start with the executive team, but include other people, other stakeholders that actually can give you the more boots on the ground view of what's going on and how it's going to impact your stakeholders. So having those policies really helps you guide even during your vendor selection process, right? So when you're picking your partners, you're going to be like, do their values align with the values that we've laid out in our Because one of the things that we didn't really talk much about was AI bias, and because we were mainly focusing on security. But I think when you're picking a partner, you want to make sure that is really on their top list as well, because we have policies in place at our organization that would never, or it would safeguard against bias, right? And there are HR policies, there are different policies that safeguard against bias, and do we now translate that to our AI policy as well to make sure that it wouldn't happen in the physical world because of our other policies? It shouldn't happen in our AI world either. And I think that having that mindset really sets you into the right place to then select the partners that will work out for you.
This has been very helpful. And I would add to what you said, Ronnie, that, I love the idea about doing the AI policy and have that kind of in place. And especially in a quickly changing environment like we're in, it's hard to kind of nail it down. And I think one of the ways you can help that, and I always advise people to do this with their EHR selections too, is to come up with a set of values of things that we expect this organization in the big picture to do, not the nuts and bolts, and it will be, SOC certified, all that kind of stuff. And like, for example, on EHR, I always said, like one of the principles ought to be that we will enter data only once. That which drives kind of your configuration of the EHR. And I think similar things for an AI model is like we expect it to do these things in the broadest sense, which will guide us for how we do implementation. These are the things we expect. And I think your idea about bringing in kind of a multi-talented group from different perspectives, particularly people who are going to be the end users of this thing, is really kind of critical to get that done. Well, Ronnie and Raz, thank you guys so much for this. This has been really a really helpful session, and I hope our audience has enjoyed it. This is Denny Morrison signing off. Thank you again for being here for No Notes.